As you stand here this morning, feel the arms around you, feel the energy around you. You are surrounded by an army. Quality of your survivorship, that is a choice.
Gerren is a marathon runner. She's a mom. She's less than the age of 40 and she was diagnosed with a devastating disease. She was diagnosed with breast cancer.
Once we knew she had breast cancer, brought together her mom, her husband, 2 kids, and we talked a lot about what type of breast cancer we discovered and the additional testing that would need to occur.
To be told I have cancer is just, it's life-changing in all the worst ways possible. You want to go into denial. All I could think was, I have to survive. I take care of everyone. I have to survive.
When I first met Gerren, I started talking about the treatment plan with her and getting her on the chemotherapy and the biologic agents. Now, a lot of these things have, tremendous side effects, so while we're going through that, we're monitoring people for the side effects pretty closely.
These drugs are life-saving drugs for patients that have cancer, but unfortunately they can affect the heart.
So I was able to sort of make the right decisions for us from a cancer standpoint and then pass her off to somebody who's got expertise in cardiac diseases, and then that's how it worked.
I have friends who have actually been in the hospital because their doctors didn't track this. They could have permanent heart damage.
And what wound up happening with Gerren is that she had only a month's worth of interruption of her chemotherapy while we were optimizing her heart care. And our program is really designed to try to minimize any heart effect and maximize all of the cancer treating effects.
I'm grateful that my doctors were so in tune with who I was that they were able to bring things to the table that made me a better person, even though I was going through this horrible experience.
Every time I meet a patient for the first time, I ask what are her hobbies, what does she enjoy doing? And I found out she had already done several marathons, and the year before we diagnosed her, she had done her first half Ironman. And she looked at my office walls and she said, "What is this?" I said, "Oh, this is meant for you after you finish your treatment." We've started this program in 2011 just as a trial project, and it was so strongly embraced. Now we not only invite breast cancer survivors, we invite patients with any type of cancer to come join us. 85% of them, at least, are still exercising to this day after they finish the program, which far exceeds the national average. Team Phoenix is all about redefining what cancer survivorship is. It's not just about getting through all of the treatments. It's about saying, hey, look at me, who am I now? I am strong, I am proud, I'm alive, and the best part is, she changes everyone around her.
The feeling you get when you cross that finish line and you know that you accomplished something that not only were you not sure you could accomplish, you suddenly have owned that cancer and you've shown your body that you are in control no matter what it's done to you.
Our responsibility as physicians is to not only care for our patients in the here and now, but we owe it to society to help generations of women in the future.
We were able to leverage all of the resources, bring this team together, and success stories like Gerren are now on a weekly basis.
We are moving the needle forward, but the fact that we're constantly moving that line forward, and we will beat this, I'm certain of that.